Hi, my name is Dr. Kim Dinan, and I'm here at Duxbury Animal Hospital to chat with you about a treatment technique that we have at the hospital called veterinary acupuncture. For those of you who are not familiar with acupuncture, it involves the placement of very tiny, small, thin needles into very specific points called acupuncture points. These points, we now know with electron microscopy, are actually a congregation of nerve endings, capillary endings, lymphatics, and connective tissue. So when we place a needle into these points, we can actually create changes in the body to help the body naturally heal itself. We also now know with the invention of fluorescent MRI that when we stick these needles into a patient or a person, we can actually see what parts of the brain light up while the needles are in, which is really interesting in our understanding of it. So acupuncture can be beneficial to relieve pain, improve mobility and circulation for patients. It can also be used to help regulate our intestines for patients that have chronic internal medicine conditions. There are points that can be helpful to alleviate coughing in patients that have chronic asthma and bronchitis, as well as points to help with anxiety and behavioral conditions, and points to help with stimulating the nerves in patients that have suffered either a back injury or a nerve injury. So when we treat our patients, what happens is they come in for a consult and we go through a thorough history and exam to determine all of the different factors about their past and what treatments have worked and not worked for them, which medications they're on, and we come up with a plan to see if they're a candidate for acupuncture and what types of needles and which points we may want to choose for them. And a lot of our geriatric patients that may also have a liver condition or a kidney condition, in addition to treating their arthritis or spinal disease that we may be working on, we will also take the rest of the factors in that case in mind and create a point prescription that helps to support the entire body. What's nice about this particular modality is that it is non-invasive. It involves the placement of very, very tiny needles. There's a small sensation when they go in, but they are very comfortable. And I know when I've had acupuncture, I don't notice the needles when they're in. It's actually a very relaxing technique. So it's non-invasive and there are no side effects to it, which is really nice, especially when we think about our older patients who may have a lot of other health conditions going on. And it is a nice, non-surgical, non-medicine way to approach patient treatment. We have some patients that they may have arthritis and they may not be able to be on an anti-inflammatory medication because the rest of the body doesn't tolerate it. So this gives us another set of tools in the toolbox to help treat them. Or we may have some of those super senior patients where we have used some of the conventional pain management options with them and they need something in addition. So we use an integrative approach with using conventional medicine and acupuncture together. So in summary, this particular technique, it has been around for 4,000 years. It's an ancient technique. It is very interesting with the science behind it and how we've learned to understand it a little bit better in the past 20 years. But it is a nice non-invasive technique that we can use to help support our aging population, our patients that have injuries and chronic conditions so that they can live their best lives. So if you are interested in acupuncture, please give us a call and I'm more than happy to see you for a consult and help discuss, if this is the best next step for you. Thanks.